Usually what I tell people, and most of the time, like I said, we will at least try to do it in a minimally invasive fashion. So what that means is that you usually have 5 small incisions on your side. Some of them are about the size of my thumb, and then most of them are about the size of my pinky finger. One gets to be made a little bit bigger, and that's where we take the specimen out of your body, or the lobe or segment or wedge, whatever it is at the end of the case. Through that, I'm going to use small incisions, long instruments, a camera, and the surgical robot to take out whatever portion of your lung I need to remove. During the time of surgery, one of those incisions will get repurposed into a chest tube site. The chest tubes are about the size of my pinky finger, and they're kind of rigid, and they're just uncomfortable. And that's going to collect any fluid that's leaking from around the lung and any air bubbles. That's your air leak.
Okay.
And that's just when there's some air escaping from the cut surface of the lung. When we do lung surgery, we use surgical staplers, and those seal with staples on both sides and then cut in between. But if you have fragile lung tissue, or if the dissection's difficult, sometimes you can end up with these tiny areas of your lung that are leaking air bubbles because the lung is like a sponge. And so that's what that tube is there for. And it has to stay in place until the volume of drainage is normal. That's usually about 200 or 300 milliliters a day, and make sure that it's not bloody, which it will look sort of bloody to somebody who's not a lung surgeon. But trust me, your team will tell you what is normal and what is not normal after lung surgery until all the bubbles are gone. Sometimes when you're in the hospital, your surgeons or your surgical team will come by and have you do weird things like cough a whole bunch of times, or try and do this thing called a Valsalva where you increase your abdominal pressure. I tell people to blow on their thumb like they're playing a trumpet, and that's going to basically exert pressure on the cut surface of your lung and help us know if there's any ongoing air leak or not. As far as when the chest tube can come out, it's when the volume of drainage is normal and when all of the air bubbles are gone. And that's usually the limiting factor that keeps people in the hospital after lung surgery.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.